the effect of drug on the eye or drug acting on the eye. The objectives of today's lecture is list the drug affecting eye, myotics, mydriatics, and antibiotics, and demonstrate the effect of different drug on the pupil of the rabbit's eye. Now, the effect of drug on the pupil of the rabbit's eye, it was the lab 2 year ago. It was conducted in the lab session, but now we changed last time this year. We are taking the therapeutics for glaucoma, and this will cover in the lecture session. So, drug affecting the size of pupil, myotics and mydriatics. You should know what do mean by myotics, meiosis, and mydriasis. Meiosis, the size of pupil is get decreased, and the mydriasis, the size of pupil get increased. If you see the initial structure here, the first one, if you see the pupil, which is a black colored, if the size is decreased, we can say meiosis. And if you see here the black portion, the pupil size is increased. So this is the main difference between the meiosis and mydriasis. To understand the term meiosis, the pupil size decreased, and mydriasis, the pupil size is increased. Now let us see the drugs which are responsible for the meiosis. Parasympathomimetics. Now it is a parasympathomimetics, and if we know the parasympathomimetics, the neurotransmitters involved is acetylcholine, and we know the receptors for the parasympathomimetics, nicotinic and muscarinic receptors. So generally, the muscarine receptor is responsible for the meiosis effect. The muscarinic receptor is responsible for the meiosis effect, not nicotinic receptor. Among the muscarinic receptor, there are various types of muscarinic receptor, but in the eye, M3 receptor is available. M3. So stimulation of the M means muscarinic, 3 receptors in the constrictor pupillae muscle of the eye responsible for the meiosis, and meiosis is termed as constriction of the pupil. Constriction of the pupil or decrease in the size of the pupils. Which are the drugs available from the category of the parasympathomimetics which stimulates the M3 receptor? These are the choline esters, carbachol, pilocarpine. These are the natural alkaloids. We can say cholinomimetic natural alkaloid, carbachol and pilocarpine. So these are the parasympathomimetic drug, act on M3 receptor, muscarinic 3 receptor on the constrictor pupillae muscle, and responsible for the meiosis. Now, there is one trick to differentiate between carbachol and pilocarpine. How can we differentiate? Both drug causes meiosis, but if we have to we have given to you two drugs. Example, for one student we are giving carbachol and another we are giving pilocarpine, blind drug without giving a name, and we asked you please identify the drug. Is it carbachol or pilocarpine? Because both drug causes meiosis, so how can we differentiate which is carbachol and which is pilocarpine? So there is one test. When what is the result of carbachol? Carbachol stimulates the muscarinic and nicotinic receptors in the eye, so it stimulates the both receptor. But meiosis is caused by the only muscarinic receptor. If there is a stimulation of nicotinic receptor, it causes twitches of the eyelid. Twitches of the eyelid. So if the eyelid twitches is present, it means it is carbachol. And if the eyelid twitches is absent, it is means pilocarpine. I will show you, give you some experiment here. Suppose example here, uh, in this, if you see the pupil size here, the pupil size here in this figure, it is decreased, it is a meiosis, and here if you see the pupil size increase, it is a mydriasis. Okay, now miotics unknown, we are giving the unknown drugs. How can we differentiate the between pilocarpine and carbachol? Here the eyelid twitches. The eyelid twitches is only present in the carbachol because it stimulates the nicotinic receptor also. And these are the direct examples, and indirects are the physostigmine, isofluorophate, and ecothiopate, which stimulates the nicotinic receptor and eyelid twitches. Now, what was the procedure for this experiment? Uh, we were studied on the rabbit eye. So we will provide you rabbit, and we will provide you the eye drops, unknown eye drops, maybe pilocarpine or maybe carbachol, and we will ask you instill the drop into the um, rabbit eye and identify whether it is pilocarpine or carbachol. Now pilocarpine and carbachol, this both drug will produce the meiosis because it act on M3 muscarinic receptor. But among this, how can you differentiate between the pilocarpine and carbachol? Check for the eyelid twitches. Take some cotton plug, and uh, this you can observe by the cotton plug also. You can also observe by initially by your eyes if there is a twitches occur in the eye. If there is twitches are present, the drug is carbachol, and if the eyelid twitches are absent, the drug is pilocarpine. So this is the only way to differentiate between carbachol and pilocarpine. What is the explanation? Carbachol is act on muscarinic and nicotinic receptor. Muscarinic receptor activation causes meiosis, and nicotinic receptor activation causes eyelid twitches present. While pilocarpine is only act on muscarinic receptor and it only causes the meiosis, but eyelid twitches are absent because it does not act on nicotinic receptor. And there are other drugs which can produce myotic effect, include physostigmine, ecothiopate, and these are categorized as anticholinesterase. This drug inhibit the cholinesterase enzyme, means we can say these are the parasympathomimetics. Second category, apart from the parasympathomimetic drugs, which causes meiosis are alpha blocker, alpha adrenoreceptor blocker, and the drug name is phenoxybenzamine. And third category of the drug which is act on the CNS are the morphine, which stimulates the oculomotor nucleus. That's why we seen In the morphine or opioid poisoning, we see pinpoint pupil meiosis. It is an the diagnostic test to identify the morphine poisoning. So these are the three categories of drug which are responsible for the meiosis. First one is the parasympathomimetics, which act on M3 muscarinic receptor. Second category is alpha blocker, phenoxybenzamin, and third one is morphine. Where it is used, generally, uh, myotics drugs are used in the treatment of the glaucoma. Treatment of glaucoma. Glaucoma is a condition and which causes or affects the optic nerve due to increase in intraocular pressure and maybe leads to the blindness if the patient is above 60 years of the age. So glaucoma is responsible for the blindness in the most old age persons more than 60 due to damage to the optic nerve or due to intraocular pressure. So meiosis effect is used to manage the glaucoma to counteract the effect of mydriatic cycloplegic drug. Mydriatic cycloplegic. Mydriatic increase the pupil size and cycloplegia. Cycloplegic drug to counteract. To counteract means opposite effect. Anti against. What is the cycloplegia? Cycloplegia is the drug which causes the loss of accommodation for the near vision. Cycloplegia. We can say paralysis of the ciliary muscles of the eye. Cycloplegia. And the drugs which is responsible for the cycloplegia are from the category of atropine. Atropine, what is the category of atropine? These are the anticholinergic drugs, or we can say parasympatholytics. And in alteration with the mydriatics to break adhesion between iris and the lanes. So if you see here the structure of the parasympathetic, here is the sphincter pupillae, or we can say constrictor pupillae. This pupillae is generally supplied by the parasympathetic innervation muscarinic 3 receptor. And stimulation causes the meiosis. And here if you see the dilator pupillae, it is generally connected with the sympathetic innervation and which causes the mydriasis. Let us see the mydriatics also. So what is the summary of this myotic drugs? The drugs which causes constrictions of the pupils are the parasympathomimetics, carbachol, pilocarpine, and their anticholinesterase drugs. Second category is alpha blocker, phenoxybenzamin, and third category is morphine. Let us see about the drug which causes mydriasis, means dilation of the pupil. Drugs that produce dilation of the pupil, or we can say increase in the size of the pupil. There are two types of the mydriasis here: active mydriasis and passive mydriasis. Active mydriasis and the passive one. What is active? When it is stimulation of alpha 1 receptors in dilator pupillae muscles. Now just we seen here, this is the dilator pupillae muscle and which receptor? Alpha 1. So please remember, when there is dilator pupillae is supplied by sympathetic innervation with alpha 1 receptor, stimulation of alpha 1 receptor in the dilator pupillae leads to mydriasis, dilation of the pupil or increase in the size of pupil. While constrictor pupillae is supplied by this parasympathetic innervation and muscarinic 3 receptors are available, stimulation of which leads to meiosis constriction of the pupil, decrease in the size of pupil. So in active mydriasis, there is an stimulation of alpha 1 receptor in dilator pupillae. This is the dilator pupillae. Last one. What happened? So dilator pupillae, this one, if you see the last circle and the constrictor pupillae, this one, if you see. Stimulation of alpha 1 receptor, mydriasis without cycloplasia or loss of light reflex. Without cycloplasia means there is no paralysis of the ciliary muscle, there is no loss of accommodation for the near vision, and there is no loss of light reflex. What is light reflex? Simple. When we suddenly see the uh, light reflex, I will explain you the light reflex. Reflex means the action upon the stimulus. And what is stimulus? Light. If we took the near torch near our eye, and suddenly we make it open, what happened? Our eyelid will closed. It is called light reflex. So when there is a mydriasis by the sympathomimetic, the pupil size will increase without cycloplasia, without the paralysis of the ciliary muscle, or loss of light reflex. Without, remember, without loss of the light reflex will not loss, means upon the light stimuli, the eyelid will close. This is the main difference between active mydriasis and the passive mydriasis. While in the passive mydriasis, if you see, there is a mydriasis with cycloplasia and loss of light reflex. With and without. Here, two terms are very important. If you see, in the active mydriasis, without cycloplasia or loss of light reflex. But in passive mydriasis, with cycloplasia and loss of light reflex. So what happened? And which are these drugs? Let us see active mydriasis, which are these sympathomimetics, ephedrine and phenylphrin are the examples for the active mydriasis. And second example is cocaine. Cocaine is local anesthetic. It also indirectly increase the noradrenaline concentration, and the nerve ending, adrenergic nerve ending, and uh, stimulates the alpha 1 receptor in dilator pupillae. So sympathomimetics and cocaines, these are the two examples of the active mydriasis with without cycloplasia or loss of light reflex. What are the examples of the passive mydriasis? These are blockage of M3 receptor in constrictor pupillae muscle. So same, they block this receptor. Mydriatic will block M3 receptor here. And if the blockage of the M3 receptor here in the constrictor pupillae, there is mydriasis. But with cycloplasia and with loss of light reflex. And examples of passive mydriasis are atropine and their derivatives, homatropine, hyoscine, tropic amide, cyclopentalate, and eucatropine. These are responsible for the passive mydriasis. And drug with atropine-like action like tricyclic antidepressant, typical neuroleptics, clozapine, serotohypnotics, and first generation antihistamics are also responsible for the passive mydriasis. Now, what is the main difference here Active mydriasis is caused by the sympathomimetics, ephedrine, phenylephrine, and cocaine, while passive mydriasis is caused by the atropine and its derivative. Active mydriasis is by the stimulation of alpha 1 receptor, while passive mydriasis is with the blockage of the muscarinic 3 receptor in the constrictor pupillae. Active mydriasis without cycloplasia or loss of light reflex, and passive mydriasis with cycloplasia and loss of light reflex. Let us differentiate these three drugs here. Now we will differentiate the phenylephrine. It is the sympathomimetic, cocaine, local anesthetic, and atropine. We can say it is anti-muscarinic drug, or we can say anticholinergic drug. Now, these three drug causes mydriasis. These three drug causes mydriasis. Now, suppose we have given you the rabbit and unknown drug, and you have to identify the drug, whether it is first one, this phenylephrine, whether it is cocaine, or whether it is atropine. How will you identify? This is unknown drug without label, and you have to identify. Now let us see one by one. Phenylephrine is sympathomimetic, cocaine is local anesthetic, and atropine is parasympatholytic. Clear. What is the mechanism? It is causes active mydriasis, cocaine causes active mydriasis. So as we discussed, phenylephrine and cocaine both causes active mydriasis, while atropine causes passive mydriasis. But how can we differentiate? Let us check. Light reflex. Next parameter. Light reflex is present in the active mydriasis. So because if we see here in active mydriasis without loss of light reflex, so without loss of means it is present, light reflex is present in phenylephrine and in the cocaine, but it is absent in the atropine. So how can you identify if your unknown drug, if your unknown drug is mydriasis but the light reflex is absent? You can write, due to light reflex is absent, you can take the torch and make it suddenly on near the rabbit eye. If the rabbit eyelid is closed, means the light reflex is present. If rabbit is not able to close eyelid upon the stimulation of the torch light, you can say the light reflex is absent. So you can say that the unknown given drug was atropine. Okay. Now let us see about next parameter, accommodation to the near vision, or we can say cycloplasic effect. As we know that the active mydriasis without cycloplasia, and here with cycloplasia. So without cycloplasia means cycloplasia is absent in phenylephrine and the cocaine. Let us see. Accommodation to near vision present because it does not affect ciliary muscle, and cocaine also present. Accommodation to near vision without cycloplasia. Yes, without cycloplasia means it is present. Cycloplasia means it is a paralysis of the ciliary muscle and loss of accommodation to the near vision. So that's why we can say the cycloplasic effect or near vision is present. And in the atropine, as it is passive mydriasis, it is with cycloplasia, means loss of accommodation to the near vision. We can say it is an absent. Now, how can we differentiate between phenylephrine and cocaine? Because all parameters up to this is same. Let us see next parameter. Corneal reflex. Corneal reflex. In the phenylephrine, it is present. In the cocaine, it is absent. So we can differentiate the phenylephrine and cocaine by the corneal reflex. How can the corneal reflex? Take the cotton thread, or cotton thread. And after the installation of this drug, if you instill the cocaine, if you put this cotton thread near to the cornea of the rabbit eye, the rabbit eye is not give you reflex, means the rabbit eye will not close, rabbit is not able to close his eye, and we can say the corneal reflex is absent. And if upon the this cotton thread stimulus to the cornea, if rabbit close his eye, we can say the corneal reflex is present and the given drug is phenylephrine. So this is the main difference. And in atropine it is also present. So only corneal reflex it is present, it is only absent in the cocaine because it is local anesthetic. And the light reflex is only absent in the atropine. So light reflex is only absent in the atropine, and the corneal reflex is only absent in the cocaine. This is the main difference. Intraocular pressure not increased, may be lowered, but atropine increases the intraocular pressure. Atropine increases the intraocular pressure. Lacrimation normal in the phenylephrine, in the cocaine normal, but in the atropine it is decreased. And about the blood vessel, this is the vasoconstriction in the phenylephrine and the cocaine. So let us see the example. Suppose it is a mydriatic and light reflex. If you see the light reflex, it is only light reflex is absent in passive mydriatics. As we discussed, the light reflex is absent in the passive mydriasis. These are the examples of the drugs are the atropine, hyoscine, homatropine, and tropicamide. So if the drug causes mydriasis and the light reflex is absent, you can say it is in the passive mydriasis. But the light reflex is present, it is an active mydriasis, and that there is two drugs, phenylephrine and the cocaine. Phenylephrine and cocaine. How can you differentiate between the phenylephrine and the cocaine? About the corneal reflex. Corneal reflex will the absent or lost in the cocaine because it is surface anesthetic, while the corneal reflex present in the phenylephrine, that is the sympathomimetics. So this is the main differentiate uh, between phenylephrine, cocaine, and atropine. So just remember, light reflex is absent in the atropine, light reflex is absent in the atropine, and the corneal reflex is absent in the cocaine. So you are able to differentiate between the phenylephrine, cocaine, and atropine. So therapeutics use of mydriatics, where it is used, generally it is used for the fundus examination of the retina, therapy of acute iritis, inflammation of the iris, iridocyclitis and keratitis, and the breaking adhesion between the iris and lens by altering them with myotics. Sympathomimetic mydriasis can be safely used in adult over age of 40. But atropine and similar agents have the risk of causing dangerous increase in intraocular pressure and this increased intraocular pressure may leads to glaucoma. So it is recommended to avoid atropine and its derivative for the mydriatic effects in the old age persons. Same here. Now, drug that affect the intraocular pressure. Drugs that increases the intraocular pressure means intraocular hypertension. Yes, it is an intraocular hypertension. These drug may precipitate an acute attack of glaucoma. What is glaucoma? In glaucoma, the intraocular pressure is increased and which may damage to the optic nerve, may leads to blindness. Increase in intraocular pressure is a side effect of untoward action of the following drugs. This is a side effect. When we use the mydriatics from the category of atropine, ganglionic blockers or tricyclic antidepressant or neuroleptics, or we can say antihistaminics, chronic use of steroid eye drops elevate the intraocular pressure, and the phenaldopam is generally used in the emergency hypertensive patient given by the intravenous route may leads to increase in the intraocular pressure. So this drug should be avoided. Atropine, its derivatives, tricyclic antidepressant, neuroleptic, first generation antihistaminics, chronic use of steroid eye drops, and phenaldopam may leads to intraocular pressure and glaucoma. And drugs that lower the intraocular pressure we will discuss in the therapeutics of glaucoma. Now, local anesthetics are used. They may be used either for surface or infiltration anesthetics. Local anesthetics are used for some eye examinations and the eye procedures. They include tetracaine, phenacaine, and procaine. Anti-allergic drugs are used to reduce the lacrimal secretion. Antihistaminics, these are the antazoline. It is given systemically. Antazoline generally used with some eye drops with the nafazoline to reduce the seasonal rhinitis, to reduce the lacrimal secretion. So antihistaminics are also used in the form of the eye drop, glucocorticoids, because corticosteroids having anti-inflammatory effects, hydrocortisone, prednisolone, dexamethasone, these are applied topically, also injected into the conjunctiva or given systemically. And the sodium chromoglycate, which is antihistaminic property, also used in the treatment of the spring catarrh. And the last one about the drugs which are used in the treatment of eye infections. Antibiotics generally used in the treatment of eye infections are the penicillins, tetracyclines, chloramphenicol. These are the antibacterial. Neomycin is antifungal. Ciprofloxacin is antibacterial. May be given systemically or locally in the eye in the form of eye drops or eye ointments. Now we have less than a minute. After discontinuation, please join again. So these antibiotics are used in the infection, maybe in the form of eye drops, maybe used in the form of eye ointments, or maybe given in the systemically. Sulfonamides, locally sodium sulfacetamide, 30% eye drop or 10% eye ointment is usually used because it is non-irritant to the delicate tissue of the eye. Its aqueous solution in the concentration of 30% is nearly neutral, and whereas solution of the sodium salts of other sulfonamides are alkaline. So neutral solutions are used locally. Sulfonamide, which is having the category of antibacterial in the treatment of eye infection. If the infection is caused by the bacteria, and if the infection is caused by the virus, we have the antiviral agents, idoxuridine, may be used in the treatment of corneal ulcers caused by viral infections. Acyclovir used in the treatment of herpes viral infection of the cornea. It is applied in the form of eye ointment 5 times a day. Acyclovir and idoxuridine, these are the antiviral drugs and used in the treatment of the eye infection caused by the virus.